na-diagnose, I used to be very thin talaga. Thin, with regular menstruation, but late 2015, sometime around December or November, I was diagnosed with PCOS. That time, ang PCOS, hindi pa siya basically well-explained. Dito na si PCOS nag-strike sa health ko. Nung nag-start akong mag-breastfeed, tapos in-stop ko na lahat. As in, kasi syempre, when you're breastfeeding, hindi ka pwedeng mag-diet. Kaya din siguro, I started having hypoglyce, especially ng afternoon. Tapos, yung weight ko, as in, ang laki ko, I started gaining weight. Super drastic yung pag-change ng weight ko from size 2 to size 8. As in, ang laki. Tapos, ang baba na ng confidence ko. Sabi na ng mga brother ko, mukha na daw kong aparador, mukha na daw kong gasol. Aside from the hypoglyco, drastic weight gain, meron pa akong migraine, chronic migraine. Mainit, malamig, whenever I'm stressed, ang sakit. So, parang binabasag talaga siya. Nahihilo na ako talaga, nagsushoot up yung blood pressure ko. Kahit walang trigger.
How did you come across Simply Nature PPARs?
Nalaman ko siya through Ma'am Jansen and Mr. Jhen. So, they introduced PPAR to me kasi one time we were having lunch. So, very big yung appetite ko. Akong excusin, Ma'am, always tired meal. Ako, he looks 30s, 20-something, mga ganon. So, sabi ko, gusto ko ako din. Kailangan, paglaki ng anak ko, mukha lang kaming friends. When I started using PPARs, first month pa lang. Actually, first week pa lang, I started texting them na, Sir Shyan, Ma'am Jocelyn, I don't have episodes of migraine at all. Kasi yun talagang kita ko. Kasi everyday, nafe-feel mo eh. Wala, even if it's cold, it's hot. Yes, kasi sabi nila, ang hirap daw, sabi ng doctors, once you got diagnosed with DM2 or diabetes, it's really hard na i-reverse.
Exactly. How did your doctors react?
They were amazed yung OB ko. First time, kasi OB ko na sila before pa eh. So, first time, since 2015, kahit ako, first time naming makakita ng clear, normal.
Guys, just to let you know, as you can see on your screen, the result actually says ovarian is bilateral. So, both sides.
Yes, bilateral. More than 20. Tapos may specific size pa siya. I can share naman yung lab result. Tapos ngayon, left is already clear and normal. Tapos yung right ko, reduce na yung size. So, working on it para ma-clear na siya. So, first of all, I wanna thank Sir Shyan and Ma'am Jocelyn. Really, as in, sobrang thankful ako sa kanila. I thank God for their lives. I have nothing but gratitude for them. Having this product improve my way of life talaga, as in. Tapos more pa para yung ibang friends ko, actually nakikita na rin nila eh. Encourage ko na rin sila, medyo nire-refer ko na rin sila. Tapos kaya mo rin to.
Exactly. And just like how Sir Shyan and Ma'am Jocelyn did it to you, it wouldn't be hard anymore because they see the improvement, they see the result on you as well.
Living witness na sila eh kung ano yung nangyaring changes. Good morning, I am Monique B. Marzan, 31 years old. I'm currently working as a property manager here in BGC. I was diagnosed 2015 with PCOS and I started gaining weight, having high blood sugar and then high cholesterol after I gave birth. And then when I started using PPAR, the migraine episodes, hypogly, and my drastic gaining of weight stopped. As mentioned, I started to lose weight and look more vibrant. So I trust Simply Nature.
Before pregnancy, I'm already taking PPARs. My husband and I, we were really taking, I think during the time, we've been taking it consistently for 5 to 6 months already, PPARs tablets. So, I even think that helped us during the this pregnancy because based on our experience, we had 2 miscarriages before my 3rd pregnancy and my successful pregnancy. And that time, we've been told that, oh, it's not healthy, that's why you're losing the baby. And then we're just, waiting on the Lord and praying for His timing. And during the time when I got pregnant, I also realized that, oh, actually we've been taking PPARs. So, because I've read and heard that PPARs helps with cell repairs, it strengthens your body, it's high in antioxidants and all that. You know, I really think that that contributed for us to have a healthy pregnancy. And yeah, that's what I also took during that time. After I have given birth, I really had difficulty because I had emergency CS. So, but after, on the third day onwards, I was actually feeling better. After giving birth, we're gifted with PPARs, so praise God, and that has helped me a lot because they said that the hormonal changes do not just happen during pregnancy and even after pregnancy. So we started taking PPARs also, and I know mommies who have given birth, I know you can relate to this. If you have experienced constipation before birth, when you have given birth, it becomes like more. It gets to the next level of constipation. So I'm glad I was able to take, and I was introduced to Cleansing Plus of Simply Nature even before pregnancy. So when I experienced all this constipation, when I took Cleansing Plus, it has helped me with my regular bowel movements and to be able to release easier and faster. When I felt constipated, because it's true, even after you have given birth, if you're already constipated, it's like it's gonna go to the next level of constipation. I don't know how it happened, but when I read about it, it's all because of the hormonal changes that happens in our body and our body adjusting and healing. So it's going through a lot. It has helped me because especially if you have given birth, whether that's normal delivery or you had cesarean, you're not really allowed to put pressure when you're about to go. So you're not allowed to push. So the Cleansing Plus really helps, no, for you to be able to release, better and easier. What has helped me in this pregnancy journey and even before that and even after is that I was taking PPARs. My husband and I were taking PPARs tablets. So that has helped me with, of course, the hormonal imbalances. It has helped us to regulate, and it has given us more energy and have healthier bodies. So it has no contraindication, so that could also help you. So you may try on your own and test it for yourself. Hi, I'm Nesta Vicencio, and here's my son, Ethan Kairos. So I had an amazing pregnancy journey and recovery with the help of Simply Nature PPARs. Thank you, Simply Nature. We love you.
Good morning, I'm Mrs. Melinda C. Hispano. Ako po ay na-diagnose ng stage 2B breast cancer, and I'm from Muntinlupa City. I'm a public school teacher. Nung nalaman ko po na na-diagnose ako ng breast cancer, syempre may devastated po. And of course, the whole family, parang our world, no, falls apart, no? Sobrang down. There is no symptoms eh. I just felt the lump. Dalawang lump siya sa right breast. And I was not really going for a check-up sa lumps. I was, magpapa-check up ako sa OB-GYN ko. And I was advised to go to the surgeon kaagad. So, after po ng operation, I was asked to go to oncologist. The protocol is to have 8 cycles of chemo and 33 radiation. When I was on the hospital, sa aking bed, browsing through the Facebook, I saw the face of Dr. Jansen. Sabi niya, makakatulong po sa mga chemo patient, yung Simply Nature PPARs. So if you will just try, malaking benefit po sa katulad naming mga cancer patient. I was advised to supplement chemo with PPAR powder saka tablet. So at first I was hesitant kasi very mahal po siya. Pero first chemo ko, taking PPARs, hindi po ako nahirapan. So I was expecting na yung mga nababasa ko, napapanood ko ng mga side effect of chemo. Hindi ko po siya naramdaman. So I was telling my family na parang maganda po yung PPAR sa akin. I finished the whole 8 cycles without any problem. Thanks to my doctor and the Simply PPAR. Kasi po, even my co-teachers, even my family, sabi po sa akin, hindi ka mukhang may sakit. So that must be a blessing from up high there, no? That I was able to meet Dr. Jansen and I was able to take Simply Nature PPAR. Latest result of my laboratory, all are normal. Yes, thank you, Lord. Continuous pa rin po yung tablet. So I just ordered 6. 6 ngayong May. So that would last for ilang months. My latest ultrasound, fixed pa din po siya. No calcification or anything. So I thank God for that. Ang papayo ko po sa mga pasyente po na katulad ko, go to the right doctor, no? You pray for the right doctor. Kasi ako pinray ko lang para bigyan kayo ng the right supplements. And para yung journey nyo, yung cancer journey nyo, will be very successful. Kaya nga sabi ko, during my PPAR journey, sabi ko sa sarili ko na I will be the most successful chemo patient in the whole wide world. Thanks, PPAR. I will highly recommend po Simply Nature PPAR kasi based on my own experience, it helps me a lot talaga. And it's a blessing to me na take ko yung PPARs. Kaya nga ang sabi ko, I will be the most successful chemo patient kasi may supplement ako galing sa Simple Nature, which is PPAR powder and PPAR tablet. So, blend together, it helps me a lot. And I'd like to thank my daughter, si Cadiz, and also my husband for taking care of me. Hindi siya nagsisisi on that part. Thankful po siya. Kaya nga, nung sabi ko, a-attend kami, and he was very supportive, binatid niya ako dito. I am Melinda C. Spano. I'm a public school teacher. I was diagnosed with stage 2B breast cancer. Upon knowing my situation, it was really a very devastating event. I was advised to do 8 cycles of chemotherapy and natatakot ako dun sa chemotherapy. But with the help of Simple Nature, na-surpass ko, nakatulong po sa akin. It's a big help. Lahat po ng side effects ng chemo, hindi ko po naramdaman. So, I'm very, very thankful to Simple Nature because it really helps me a lot. And ang feeling ko, I'm a very successful chemo patient because of Simple Nature. I trust Simple Nature.
Good evening, everyone. I'm Sheila, and welcome to another episode of Simply Healed webinar. This program is proudly brought to you by the collaborations of Simply Nature International and Simply Healed Medical Group, united by a shared mission to support healing through education and science-guided care. As an international leader in wellness, Simply Nature specializes in high-quality supplements sourced from a unique strain of microalgae known as PPARs. This research-backed nutritional approach is widely recognized for its ability to support cancer patients, boost immune function, and improve metabolic health. Before we officially dive into our program, we want to take a brief moment to look back and express our deepest gratitude. Last Saturday, we held a wonderful event at the SMX Convention Center in SMX Aura, and it was an absolute privilege to connect with so many of you in person. To the incredible patients who joined us,
is very
thank you for
useful.
sharing your
Number
time,
two, it was a
your
great
questions, and your
opportunity.
strength
At
with
saka,
us.
napakaganda.
You are the
Sa mga
reason
katulad
we
ko
do
naman na
what
may
we do.
cancer,
We
why
also
not try
want
the
to extend a
PPAR
heartfelt
forum
thanks to our
para
esteemed
mas
doctors and
mag-guide
healthcare
sila.
Big help
professionals
po para
who
sa
attended
mga
and
may
lent their
karamdaman.
vital
Kasi
support to
naibibigay
this
sa amin yung mga
initiative.
tamang mga
Our greatest
angkop
hope
na
is
gamot
that
para
you
sa
walk
mga
away
karamdaman
with
namin.
last weekend's event having learned a lot of valuable information from our discussion. More than that, we hope that you are able to relieve a sense of comfort, strength, and hope to see each one of you in our next event. Now, whether you were able to be with us in SM Aura or are tuning in online for the first time tonight, we are so grateful to have you as part of this community. Now, let's keep the momentum going with today's session. Now, every day, our lungs are on the front lines, filtering the air we breathe and defending our bodies against toxins, pollutants, and pathogens. Yet, we rarely appreciate their hard work until breathing becomes difficult. Today, we are shifting our focus away from superficial fixes to look at where true immunity begins, the cellular level. This brings us to our core topic, the cellular defense, the PPAR's way of strengthening lungs resilience. We will explore how to actively fortify our respiratory system from the inside out, ensuring our lungs are structurally equipped to resist threats rather than just reacting to them. To build this resilience, we must look closely at peroxisome proliferator activated receptors, or what we call PPARs. These essential cellular proteins act as master regulators, controlling everything from metabolic function to inflammation. When it comes to respiratory health, maintaining a balanced inflammatory response is crucial. Chronic inflammation degrades lung tissue over time, leaving us vulnerable. By activating the PPAR pathways, we tap into a natural biological mechanism that regulates cellular stress, protects lung tissues from oxidative damage, and optimizes healing. This proactive approach gives your lungs the structural support they need to maintain optimal airflow and bounce back from environmental strain. Strengthening your lung resilience is about moving beyond temporary relief and investing in long-term cellular health. As we wrap up this overview of vital role PPARs play in protecting your respiratory system, we want to hear from you, of course. What specific questions do you have about supporting your lungs at the cellular level or integrating the PPAR pathways into your wellness routine? Please drop your comment section or thoughts or scenarios into the chat or the comment section now. No questions is too simple when it comes to your health. We are eager to dive in and help clarify how you can best support your body's natural defenses. Once again, the intention of today's webinar is to make sure we answer more questions coming from all of you for us to be able to empower you even more in your journeys. So without further ado, let's dive right in. It's an honor to present our esteemed speaker, Dr. Jansen Calalan, a distinguished graduate of St. Luke's College of Medicine. Dr. Calalan is a diplomate of both the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. He currently serves as an integrative oncology practitioner at several renowned institutions, including Alta Integrative Medicine and Wellness Complex at Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holístico, Meta Medica, and Simply Healed Medical Group. There, he offers integrative therapies that complement conventional treatments and provides patient-centered care to those who have chosen to pursue their own path through cancer. He will be joined by a Singapore-based PPARs expert. As a visionary CEO behind Simply Nature International, he combines his entrepreneurial success with years of international speaking experience to share deep insights on how health serves as the foundation for true success. Let's all welcome Mr. Shyan Lim. Good evening, Sir Shyan. Good evening, Doc Jansen.
Good evening, Sheila. Good evening,
Hey,
Doc.
good evening.
Yeah,
Good
Doc, I
evening.
want to thank you again for joining us last Saturday. It was wonderful. And thank you for sharing with us. Those of you who didn't were not able to join us, you missed out because Doc gave us a PDF copy of his guidelines. And he went through a wonderful presentation on how to strengthen yourself for cancer. Okay, Sheila.
Let's dive right in. Okay. Okay, for our first question tonight, coming from Mr. Julius Balmores, is this PPARs good for prostatitis?
Okay,
Inflammation.
prostatitis is inflammation of the prostate. So you have to find out the root cause first before we claim anything if it works or not. So reasons why you can get prostatitis. Number one would be infection. Okay. So if it is an infection, then you have to treat it with an antibiotic. Okay. Another one is if you have BPH. No, BPH can also be uh, associated with inflammation. Okay. But the inflammation in BPH is different from the inflammation prostatitis. In prostatitis, it's acute infection, but for BPH, it would be chronic and low grade. No, so if it is the case, then PPARs can help. Okay, especially for chronic low grade inflammation. Now, if the prostatitis is because of radiation therapy, then PPARs can also be used to help lower the inflammation. Okay, so those are some of the applications. So it's not a simple yes or no. It depends on what the reason is.
Thank you. Sir Shyan,
Are you-
would you like to add anything?
Yeah, correct. Just as Dr. Jansen said, it's important to identify the root cause. But if you're looking for something that can help you right now, then I would suggest the tablets. Simply Nature PPAR tablets, right? Because they help with inflammation in general and they help with metabolic syndrome. So if you have inflammation of the prostate, I would make a good guess that being Filipino and having an inflamed prostate, you might have some elevated blood sugar issues, blood cholesterol. So just the tablets alone will be just a general, wonderful basic supplement that helps you with inflammation, helps you with manage your metabolic syndromes as well. Yeah, so I think that'll be a good start. Then once you find out what exactly is the cause of your inflamed prostate, then you can get the specific solution to it.
Thank you. This concern is actually perfect, no, for the upcoming Father's Day this month. And I just wanted to know, this June is actually Cancer Survivors Awareness Month as well. So there. Thank you, Dr. Jansen. Thank you, Sir Shyan. Okay, for our next question coming from Mr. Iggy. Question is, are your supplements or meds a standalone treatment, or is it used as a supportive to conventional treatment? Very good question.
Okay, Doc, you let me take this one now. Because for Doc Jansen, so for different medical practitioners, they will use our products differently. Okay, so for example, I'll just highlight a combination or a few prominent doctors. First of all, Dr. Jansen, who is here with us, is an integrative doctor who specializes in cancer. So he will use it in a few different modes. Maybe I'll ask him to share how he uses it. But I'll share with you, we have naturopathic doctors, that means doctors that use just natural therapy. Then for them, this is one of the key protocols that they will use. That means they will use it almost like a standalone, but not really. Very few of our doctors, when you're dealing with cancer, will actually use our product as a standalone, because all our doctors understand, whether you're conventional or natural, to treat cancer is not one product. It's going after cancer from different directions, different angles, working together to give you the results to fight cancer. All right, so I'll talk about one of the top lifestyle medicine doctors. He's Dr. Johan. He treats patients with only diet, okay? Only food. The only supplement he uses that I know of is actually Simply Nature PPARs. Because our products are totally natural, we don't add anything to it, no additives, no binders. It's basically plant-based whole food, right? But our extracts are, of course, not just plant-based whole foods. They are plant-based whole food concentrates extracted. So that part is not 100% like eating. It's not 100% food, it's an extract, okay? But our tablets is 100% considered food. Okay, so that's Dr. Johan. He uses it as part of a natural therapy. Then we have one of the top orthomolecular practitioners in Philippines. He uses it as one of his foundational protocols. Every time he treats a patient, he has three things he will do. He will give the patient a very high dosage vitamin C, but not as an antioxidant. But not as a pro-oxidant, still an antioxidant. So he doesn't use the IV drip. He just uses high dosages of vitamin C. Then his next foundation is Simply Nature PPARs. He will use it as a catalyst. So Simply Nature PPARs basically magnify or turbo boost whatever protocol he will design for the patient. And the third thing that he will use is very tailored, specific vitamins and minerals just for the patient's condition. So on average, his patients actually take almost like a small bowl of supplements every day. But Simply Nature PPARs is like the turbo booster for everything. So he will, especially for his critical patients, he will always use vitamin C and Simply Nature PPARs, and then he'll tailor. And then we have pure conventional doctors, oncologists. They will use it to manage the side effects of chemotherapy, okay, and to prepare patients for surgery and recovery as well. So I've covered the conventional oncologist, I've covered the natural, I've covered an orthomolecular practitioner. Now I'll let Dr. Jansen share how he uses Simply Nature PPARs.
Yeah. So I usually use it as combination. It's a support, no? For the conventional oncology treatment. Okay, so whatever that may be. Okay, because Simply Nature PPARs can work well with chemo, radiation, and immunotherapy. Okay. It's just that, of course, for chemotherapy and radiation therapy, since both are oxidative treatments, I make sure that Simply Nature PPARs is being taken during periods when the patient is not on these two treatments. So for chemotherapy, that would be I allow I allow the body to wash out the chemotherapy first before starting PPARs. So PPARs, I use it basically to hasten recovery, okay, in between cycles. For radiation therapy, I usually allow patients to take the PPARs during rest days. Okay, so again, this is to enhance speed of recovery. And of course, when you're finished, when you're done with these two, no, to repair the body from these two, I also use Simply Nature PPARs. So it really depends on the situation as well of patients, because sometimes during times when patients cannot tolerate chemo and radiation already, then of course I will use Simply Nature PPARs as a standalone treatment now. Okay, so there are a lot of pillars that Simply Nature PPARs can work on for cancer. So that can be with metastasis and apoptosis of cancer cells. It can also work in the environment of cancer, wherein it reduces inflammation, it improves the immune function. Okay, even metabolically, no, because PPAR agonists, by its name, we actually have two drugs, no, two classes of drugs under PPAR agonist, PPAR alpha and PPAR gamma, which are your phenylfibrate and pioglitazone, both of which reduces triglycerides and improves insulin function. Okay, or it improves insulin sensitivity, it lowers blood sugar. So PPAR agonists does these two. So it also has an impact on metabolism. So the environment in which the cancer is in, we can also address that. So yeah, I use it that way. So it's standalone and combined, depending on the need.
Okay. My last comment to this question is, maybe the viewer wants to know if Simply Nature PPAR products are support products, or do they actually on their own have therapeutic effect? I think this maybe is the root of your question, because for example, taking multivitamins is not a therapeutic effect, diba? It's just something you take as support. So maybe his question is about that. Then let me share with you Simply Nature PPAR extracts, our liquid, our powder, our soft gels. These are not just support. They will actually have effect, medical effect, because we actually understand the mechanisms of action. So back to your original question, it's not a support, right? It actually has mechanisms of action to have therapeutic effect. It has the same effect as the drug PPARs, all right? The same way it works, because in conventional medicine, there is PPAR-based drugs, all right? So it works in the same mechanism of action. So I hope that will address your question as well.
Thank you. Thank you, Sir Sean. Thank you, Dr. Jansen. I believe now that how you answered the question of this viewer of ours has validated that this is very much concern of a lot of our patients now. Common question, actually. So thank you, sir, and thank you, Dr. Jansen.
Yeah, because I think many patients are wondering, is this a supplement? Or is this something that doctors use to heal people? So the answer is, to healthy people, it's a supplement, right? To patients who are sick, it is actually what doctors or health practitioners will use to heal you. Okay, so it has that effect. Yeah.
Yes, but in whatever situation you are, PPARs could help. And for those of you who wish to have a consult with Dr. Jansen, he has other modalities that he can incorporate. Please message us how to consult. Our caring HRS, Miss Beth and Miss Irish, will definitely get in touch with you. All right, for our next question. Okay, next question coming from Mr. Bimbo. Is this PPARs FDA approved? Sir, you might want to say that this is more than just FDA approved.
Okay. Okay. I think Sheila is just reminding me, yes, it is FDA approved. Not only Philippines FDA, it's also US, Singapore authorities. Yeah, in all the countries that we distribute, it is actually registered and approved. All right. On top of that, Simply Nature PPARs is actually listed in Philippines MIMS. MIMS is the catalog for doctors for their drugs. Okay, they do include some, very few. All right, they do include some supplements, and Simply Nature actually falls into that category. And in the MIMS, in the doctor's catalog, we are listed. The function is to support, as Dr. Jansen said just now, to support chemotherapy patients to reduce the side effects of chemotherapy. So yes, approved.
That's right. Thank you. And of course, trusted by doctors as well, like Dr. Jansen. Thank you. All right. For our next question coming from Ms. Nida, question is, how to fight lung cancer?
Wow, that's a very broad question. Doc, how do you fight lung cancer? Doc, maybe we will just adjust it also. What's the general way to fight cancer? And then maybe your advice on specific, especially if you have any protocols for lung cancer that is different. Yeah.
Yeah. Okay. So how do you fight it? What I'm going to share would be how standard of care advises us to do so, and then how integrative medicine can help a patient, no, have better success. Okay, I think that would be a better approach. So, standard of care. So if you got diagnosed with a lung tumor, first we have to rule out infection. So you have to first rule out infection versus cancer. Okay, because the treatment, of course, obviously, the treatment would be very different, for infection and cancer. Now, how do you differentiate? No, so one would be to do a biopsy if and when the tests for infection are negative, it comes out negative. Okay, so for a biopsy, you get a sample, then that is going to be analyzed in a laboratory, and the pathologist will take a look at it, under the microscope. So if it is cancer, then further testing has to be done, because you would now want to know if the lung tumor is positive for EGFR mutation. So EGFR mutation, if that's positive, then you would be a candidate for oral targeted therapy for lung cancer. Okay. If this is negative, then usually it's usually either surgery or chemotherapy. Radiation therapy nowadays, it can also be done already. There are radiation therapy machines that can target tumors in the lung. All right. So depending on the stage, no, so you would want to know the stage. So once you get the biopsy, you would want to know the stage. So the stage will determine whether surgery would be enough. Do we need chemotherapy first, or do we need localized treatment or systemic treatment? So these questions would be answered by imaging studies. So imaging studies usually would involve PET-CT scan, because you would want to know if whether or not the lung cancer cells are confined to the lungs or have they metastasized elsewhere. Okay, so you would want to know the stage of the patient because that would determine treatment. Okay. Now, once you have determined treatment, so that would comprise of, depending on the stage, can be chemotherapy, targeted radiations, or surgery. Now, so let's zero in on the chemotherapy because that's what usually people are quite wary of. So, for chemotherapy, how then can integrative medicine support a patient so that the patient can finish the chemo? So usually my approach would be to address cancer metabolically, immune, and to help improve the killing effects of the chemotherapy by reducing resistance or tumor resistance or resistance factors that the tumor is expressing. So for the metabolic, we starve the tumor of its fuel. So the fuel of cancer would be glucose, glutamine, and fatty acids. So okay, if you go on a diet, okay, the diet, there's no way on there's no way on how you can prevent the absorption of these three fuel by diet alone. Okay? Because if you look at the basic materials, glucose, fatty acids, and glutamine, this is essentially carbohydrates, fats, and protein. So if you go on a diet, you won't be eating anything anymore. So that's not the proper approach here. The approach should be what diet will give you the most increase in survival, the easiest to do, which you will give you the most happiness. Okay? Because food is pleasure for most of us. All right? Especially for Filipinos. So now for this one, the Mediterranean diet is usually the foundation. It would be a good foundation as a dietary pattern that you can follow. Okay. Now, how then can you starve the cancer of these three fuels? You use natural extracts or the purpose drugs. Okay, some examples would be berberine, ivermectin, bendazole, vitamin C. It can also do it as well. Green tea or EGCG that can inhibit glutamine absorption. So some medications like metformin, aspirin, so these are drugs that can help reduce any given tumor's absorption of these three fuels. Okay. Then the second approach would be immune. So this is where PPARs comes in. Okay. So for immunity, you have the immune system itself and inflammation. Okay. So if the inflammation is too high, it can mean two things. If the inflammation is too high, either the immune system is overacting, or since the inflammation is too high, the immune system is getting killed because of the inflammation. Okay, so these things go hand in hand here. So the beauty with Simply Nature PPARs is it addresses both. It can improve dendritic cell expression, NK cell expression. Since Simply Nature PPARs, basically it's omega-3 fatty acids. So it's very rich in omega-3 fatty acids that can help reduce inflammation as well. So it targets the environment and the immune system at the same time. Okay? So there are other supplements that we can use here. Examples would be mushroom supplements, rice bran supplements, wheat germ extracts, no? So these are some examples. Another one that I use is thymosin alpha 1. It's a peptide that improves lymphocyte count. Okay? So it's usually a combination of these products. Then for the cytotoxic, how then can you improve the cancer killing power of the chemotherapy? You inhibit a pump that we call the ABCG2 pump. So this ABCG2 pump is an efflux pump. So if it usually cancer cells would have this. Okay? The function of this efflux pump is that anything that goes through it, the cancer cell will vomit out. Okay? So essentially, it will neutralize whatever medication that you will have that acts directly on the cancer cell. Okay? So what can you do to inhibit this? You can give medications and natural extracts. So examples would be curcumin, quercetin, resveratrol, genistein, apigenin. These are a few examples. Medications that inhibit this would include ivermectin, pantoprazole, febuxostat, and many others. Okay, so it's usually a combination of these things. Now, this is basically the approach. Now, it seems a lot, okay, and I cannot promise that it will work 100%. So there is something that we can use, which is liquid biopsy. So the liquid biopsy is when we get a sample of blood from the patient, and then the laboratory will detect and isolate the circulating tumor cells. So the circulating tumor cells, they will grow it in the laboratory and test different substances against it. And then that list the laboratory can give us so that we will know what medications will kill or not kill the cancer cells. And then we can base our protocol on it. Okay? Now, it's not as simple as, okay, this drug worked, so we use it, and this drug didn't work, so we don't use it. It's not as simple as that because drugs and medications for cancer does not only work on the cancer cells themselves alone, it also works on the environment. So the assessment or the use of the medication or the substance or the natural extract will depend on the gene expression of the cancer cells as well, and the situation and the current situation of the body of the patient. So it's a combination of these. A little bit complicated, but it's fairly simple. It's fairly simple. Okay. Yeah, so that would be the approach, basically.
Thank you, Doc.
I think Doc gave you the full approach, but remember, this program is not a consult, right? So now that you have an idea, I think it's a great idea to then have a consult with Dr. Jansen for your specific case. Yeah.
Yes.
Yeah, I just told you my medical practice already.
Right. Well, I must say everything is quite interesting with what I heard with the pump and everything. It's really interesting. Thank you, Doc. Thank you, Sir Shyan. Okay, for our next question, coming from Ms Shika Neri. Question is, Doc, I have breast cancer. How will I use this? Because I am opting for natural side.
Okay, so if you are opting for natural or the non-conventional way, the way you use it is you pulse it together with vitamin C. Yeah, with vitamin C, intravenous vitamin C infusions, because IV high dose intravenous vitamin C infusion can kill cancer cells. It can actually shrink tumors. No, I have seen this. Now, if you're going to use Simply Nature PPARs and intravenous high dose vitamin C infusion, you cannot take PPARs on the same day that you're going to take the vitamin C infusion. Because the vitamin C at very high doses, it acts as a pro-oxidant. So it's very similar to chemotherapy in that it generates free radicals, reactive oxygen species to kill the cancer cells. No. Now, if you took any antioxidant, not just Simply Nature PPARs, any antioxidant for that matter, prior to the infusion, then the antioxidants in your blood will eradicate. So the vitamin C will eradicate that background antioxidant first before reaching the tumor. So very important to know the difference. No. So another another medication that you can consider would be ivermectin and mebendazole. So these two repurposed drugs, these are antiparasitic drugs. No, these drugs are used for deworming. That's the FDA approved use. However, there are a lot of preclinical studies that showed one very good anti-cancer effect of these two drugs. So these two drugs can also be used in this sense. Now, again, these drugs should not be used continuously when you are receiving high dose intravenous vitamin C. It has to be pulsed with it. Okay, so there are many others that you can use. Those strategies I have mentioned in the previous question. But basically that's the general approach.
Thank you, Doc. Sir Shyan, would you like to add anything?
Yeah, I would say, because she said she wanted to treat cancer
Yeah.
naturally.
Yes.
Then the most natural one would be, like I mentioned earlier, Dr. Johan. He would actually want to make sure, number one, adjust your diet, right? Adjust your diet. So really no processed food, if to the best of your ability. No red meat, no meats in general, actually. It's all whole plant-based whole foods, all right? And then it will be liquid extract with tablets, all right? So at least one liquid extract a day, if not two. Again, depends on your staging of your cancer and everything. So just continue to ask questions for the specific dosage by giving us more details of your cancer type. Then we'll give you the general guideline, all right? So that's a way you can start. You can also have a consult with Doc Jansen. You can also tell him, Doc, I only want natural. He will also give you a totally natural approach. You can do that as well. Yeah.
Thank you, Sir Shyan. Oh, in some cases, you may want to also incorporate Cleansing Plus in your protocol. Doc Jansen, I have a very quick follow-up question on what you said earlier about the vitamin C drip, no? Is it like because you've mentioned that they cannot take PPARs within the same day. Or is it like the chemo drug half-life that we have to consider the number of hours, or is it like the 24 hours upon finishing the vitamin C drip that they can take the PPARs already?
Okay. If we only check the half-life, strictly speaking, no, after receiving the vitamin C infusion, in 6 hours, that would be flushed out of the system already. 6 hours. So after 6 hours, you can begin taking all antioxidants. But for simplicity's sake, I always ask patients just to skip the day. Okay, because usually the 6 hours, it's very difficult for them to remember. So rule of thumb, just skip the day. So everything is simple.
Yes.
Okay, but technically speaking, if you look at the pharmacokinetics is a big word, but if you look at how the body metabolizes the vitamin C, this high amounts of vitamin C, then it's 6 hours. 6 hours would be enough.
Thank you, Doc. Very helpful. Thank you, Sir Shyan. Okay, another question coming from Ms. Vilma Te. Okay, question is, can I take this product even if I don't have cancer? My metabolism is really weak, and sometimes I am constipated. I'm already 54 years old.
Absolutely. Okay, you can. I take it. I've been taking it for 20 over years. The benefit is anti-aging. Okay, yes, you can. It's one of the best. Now, for your case, you actually only need to take the Simply Nature PPAR tablets. All right. So that's the really good news for you. Both the fact that you have found something today that can help you. Number two, that you can just use the basic product. All right. I just give one extreme example because you're just feeling general weakness, but I just want to take the opportunity, right? Many of our cancer patients who are bedridden or very, very weak, when they take the liquid extract, they actually get stronger within like before the box of liquid extract is finished, they really recover quite a lot of strength to the extent that they can eat or they can even walk with assistance, right? So the most severe case of weakness is actually many years ago, almost 14 years ago, when I first went to Philippines. There was a particular patient from Cebu. He called in, his son called in Actually, the son is the one that spoke to us. He has a father in his late 80s, early 90s. I can't remember, it's 14 years ago, but very old. And what he was sharing with us is the father is in ICU. There is no single one problem with the dad, all right? But the dad was dying. Why? General organ failure, right? That was what the doctors told him. The dad was just old and his body was just giving up, not working anymore. So I think that's the most extreme case of what you were talking about when you describe yourself, that you have a weak metabolic, weak metabolism in your body. So you probably feel fatigued and weak, and that you know that you're not healthy, and you want to build your health up because you don't want to develop any serious illness, right? So this is the most extreme case. It's a elderly that is actually dying because his general organ failure. So his son smuggled, because it was not allowed. So back then we were not recognized, we were not in MIMS and everything. So he's actually smuggled the liquid in and he fed it to the father, right? So after like a week, the doctors were clapping their hands, saying how good they are, because the father was gaining back strength. And the son was telling us the doctors were mistaken. They thought that they were helping his dad, but he knew it was actually the Simply Nature PPARs. All right, so just to share with everyone that, yeah, Simply Nature PPARs is just so good to generally strengthen yourself. Why? It strengthens your metabolic pathways, which is your metabolism. It strengthens your immune response. It strengthens your inflammation response, right? All these three already makes you healthy and protects you from all the general diseases that we have today, from cancer to diabetes to whatever, right? It's all related to these three. If we cannot treat it directly, we will still be able to help. Just like, for example, I have a Dr. Alhambra. She's a neurologist. She actually uses our product to help schizophrenia. Right? That's a brain disorder. Obviously, Simply Nature PPAR does not cure schizophrenia. But what it did was that it helped to reduce the brain inflammation and it calmed the patient down. So it really did have the effect. And it confirmed, because I've also noticed with my personal friends, I have two personal friends who have autistic children. So when the children take the PPAR tablets, their autism doesn't like go away or anything, but the children calm down. So then when Dr. Alhambra used our product to calm the schizophrenia down, it made sense to me. So I guess it's got to do with the brain inflammation, which causes the people with brain disorders to get agitated, and that stresses them out, right? Okay, so that's for you, all right? But if you're not in any of these serious case, the good news is just the tablets. But give yourself 3 months, okay? Now, how many do you eat? You actually want to recover, right? You want a therapeutic effect, not just a maintenance effect. Then I would suggest, ideally, I would actually say 10 micro tablets 3 times a day, minimum 10 micro tablets twice a day before food. All right, yeah.
Thank you, sir. All right. I'm sure, doctor, you have anything to add? I'm sure that you have patients walking into your clinic. They also don't have cancer. Do you also incorporate PPARs with them?
Yeah, I do. But usually for these cases, I use PPARs for detoxification.
That's true.
Yeah.
Thank you. I love these kinds of questions. They don't have any illness at all, but they're very cautious. They really try to prevent anything from worsening. Okay. Thank you so much. All right, for our next question, just a sec. Okay, coming from Ms. Tessa Alvazo. Okay. Good evening po. I'm interested with PPAR's tablet. Can this be sufficient for a person who has undergone angioplasty with high blood sugar, high cholesterol, and blood pressure?
Okay. This question is a loaded question. It's a dangerous question to answer, okay? If you are asking me if PPAR tablets is great for such a patient, the answer is yes. If you ask me if simply PPARs alone is enough for the patient, I would say no, right? If you are on medication, please, because you've gone for angioplasty. If you've gone for angioplasty, means you were at risk of a heart attack, okay? So you're not a general case, right? If something goes wrong, if it's unattended, you can have a serious consequence. All right. So for this, I would really recommend you have a consult with Doc Jansen. Right? Doc Jansen deals with many patients with metabolic syndromes, high blood pressure, high blood cholesterol, so on and so forth. So why would you need to meet Dr. Jansen? For a very simple reason. I don't want you to drop your medication immediately, right? Because it's so dangerous, because you have all these together, and you've gone for angioplasty. That tells me how serious your cholesterol levels were. Okay, so good news, you can work your way, maybe maybe more realistically, 6 months from now, you can be off your maintenance meds once Dr. Jansen clears you. He will probably put you on a program for you to be able to reach that point. So the good news is, when you ask this question, I'm sure you're trying to find a natural solution for all these illnesses that are actually related to one another. The straight answer is yes, you're going to reach there. It's whether it takes 6 months or maybe slightly longer is another, depends on your condition. But yes, you can actually reach the point where you can drop your maintenance meds, but don't do it without doctor's supervision, because I think your case, if anything is not done correctly, you might risk a heart attack, and that's not good. Yeah.
Thank you, Sir Shyan. Thank you, Doc Jansen. Okay, for next question.
So go for a consult with Doc Jansen, okay?
Yeah.
So that he can share with you what to take. He might even get you to take the soft gel capsules or something, or even a powder, right? And then later, or maybe the tablets is enough. He'll decide, and then he'll help you taper it off. Then he'll get you to monitor your blood works so that you know everything is managed. So do not drop medications down just like that. All right, because you've gone for angioplasty. That's not something that you just ignore. Yeah.
Thank you, sir. I'm sure that Doc Jansen would want to incorporate other laboratories as well when she goes to Doc Jansen.
Yeah, and anyway, you're doing a good thing. You're doing a right thing, because drugs just basically maintain. PPARs will actually reverse your situation, because here's the thing. It is so common for a patient who's gone for angioplasty to go for another one a few years later, right? It's just like it's very common for a patient with a stent to have 2 stents, 3 stents, 4 stents. So it's got to do with also your lifestyle. So just taking a drug to maintain is not going to solve your issue long term. So you've made a very right choice that you actually want to get this done naturally. You also need some discipline, have some lifestyle changes. No matter how good any product is, it's not gonna help you if you're not gonna adjust your lifestyle. All right. So please see Dr. Jansen. You're gonna be able to get well and be off your maintenance meds. Just give yourself some time.
Thank you, Sir Shyan. Thank you, Dr. Jansen. I hope that this encourages you more, that, here in Simply Nature, we're very responsible with our patients. We really would want you to coordinate with your doctors or continuously with Doc Jansen so that they can monitor you.
Cancer is a continuous.
They would really love to see your improvement along the way. All right, for our next question, coming from Ms. Noreen Magrino, question is, can it help for anemic patients, low hemoglobin?
Okay, depends on what the cause of the hemoglobin, the anemia. Depends on what the cause of the anemia is, no? So the application of Simply Nature PPARs in patients who have anemia is this. If the anemia is caused by inflammation, then it can help, because Simply Nature PPARs is very wonderful in lowering inflammation. Okay, so what is it in PPARs that's the ones that lowers the inflammation? It's the omega-3. Okay, so patients who develop anemia as a result of inflammation usually would have cancer or any chronic disease. Okay, so since we're talking about cancer, that's I usually use PPARs to help manage the side of the inflammation. Then the anemia itself, we have to either do blood transfusion or inject erythropoietin, one of those. Okay, then of course supplement with iron supplements still. Now, if the anemia is caused by anything other than inflammation, then no. The answer is You cannot just rely on Simply Nature PPARs. It has to be, you have to identify the actual reason why you have anemia in the first place and address that. Okay, may it be nutrition, may it be genetics, or may it be blood loss. Okay, so if it's blood loss, you have to stop the bleeding, right? So yeah, if it's inflammation, then yes.
Thank you, sir. Thank you, Doc. Sir Sean, would you like to add anything? Okay, all right. For our next question, another interesting one. Okay, coming from Miss Joy. Ma'am, what can you recommend for a not paralyzed stroke?
Oh, not paralyzed stroke. Okay. I definitely straight off, I will recommend that you go on Simply Nature PPAR tablets. Number one, in general, all right, in general, regardless of your condition, go on the tablets. It's going to help you keep healthy, keep the next stroke away. Now, how much is enough? It will depend on your situation. So for a stroke patient, I'll just say 10 micro tablets 2 times a day. This will be something you'll be taking for the next few years. All right. You just got to have a supplement like this in your life that is all natural, so that when you take it for a few years, there's no build up, diba? No toxicity. You don't worry about any, oh, I eat this thing every day for a year. Is this going to have any side effects? No, it won't have. It's plant-based whole food, right? So you're just eating a food. So this food is like something that you take, right, to manage your cholesterol, your build up, right, and all your metabolic syndromes for someone who has had a stroke. Okay, and it will also, in general, help you with the recovery as well. It will help you with the recovery as well. Okay, so this is just on a basic level. Now, non-paralysis. So my personal experience with the most extreme case of stroke, where I actually meet the person, talk to the person, the person was actually he's an Indian in Singapore. He's actually the owner of the largest spa chain at that time. So his stroke is not because of health, because he's actually a health nut. So he's very into Ayurvedic, which is Indian medication, natural medication, and he's very health conscious. He owns a spa, all right? And so he actually believes in wellness, right? So he owns a wellness center. So his stroke is because of stress, work stress, right? Okay, then he had a stroke. He took Simply Nature PPAR liquid every day for almost a year. All right. And his doctor actually thought that he would never walk again, but he did. Hey, but he did. So it really helped with the recovery. He was very disciplined in his physiotherapy as well. He really took care of his health, what he ate, but the PPARs he took was to really help his recovery, because his doctor basically told him his life will never be the same again. Because imagine after the stroke, even his lips were lopsided. Both his hands were like that. He couldn't move at all. He couldn't move below the waist. But today he's walking on his own. All right, even without a cane, without any assistance as well. He talks like normal, with a slight lisp. Okay, with a slight lisp. And yeah, so that's an extreme case of what a stroke patient. Again, this is the same thing that what Dr. Jansen is trying to share, and I shared about schizophrenia, brain disorders. Simply Nature PPAR will not reverse everything, but it's going to be one of the most important things that you can consistently do. Okay, then on top of that, you have to do your, for example, physiotherapy. For my friend's case, where he lost all his mobility, right? You might have specifically some other issues. Then on top of Simply Nature PPARs, do that extra thing that you need. But Simply Nature PPARs is not going to solve everything, but it's going to help. It's going to be very important part of your strategy, maybe even foundational. It will make the difference. It will make the difference, regardless of what others that you're gonna. It will actually make a difference.
Definitely. Dr. Jansen, would you like to add anything?
Nah.
Okay.
Yeah.
It is quite an eye opener, and not paralyzed stroke. And Sir said that it was for his friend. It wasn't really because of the high blood cholesterol.
No,
it was
yeah.
really with stress.
No, actually, he was facing a company takeover, so it's very stressful
Oh.
thing when you have that. Okay. Yeah.
Okay,
He
thank
actually
you.
collapsed getting out of his car in the parking in the car lot. Yeah.
But it's still quite encouraging that you've mentioned the story
Yeah.
that you've mentioned is for a paralyzed stroke patient. But this for this not paralyzed
Mm.
stroke, of course, all the more that PPARs could help. Yes.
Yeah.
Thank you. Thank you, sir. Thank you, Doc Jansen. Okay, I think this will be our last question for today.
Mm.
Coming from Mr. Johnny Kiza. Question is, I'm stage 4 prostate metastatic cancer. I hope and pray your procedure can help me recover. What shall I do? Please say.
Wow. Now,
Uh, Stage 4. So if it's stage 4 prostate cancer, then usually for these cases, it would be hormone therapy, no? That the oncologist will prescribe. Now, of course, number one, you have to change your diet. One of the so there was a study that was published already wherein they only used lifestyle interventions and they saw a reversal in the trend of prostate cancer progression. Okay, so they actually measured the PSA levels of the participants and the PSA levels went down. So the lifestyle intervention that they used was a whole food plant-based diet and exercise. Now, this was for early stage prostate cancer. But still, since it is prostate cancer and you're going to, well, it's free to move. You're gonna eat anyway, so might as well follow. Okay? So that's my take on it, no? Although, of course, the study was for early stage prostate cancer where they saw a reversal. But nevertheless, since the intervention is actually not harmful, so you can just follow anyway. It will still benefit you, even if you are stage 4 and not early stage prostate cancer. Now, number 2 would be, yeah, pursue the hormone therapy. You have to be on it, okay? Because that's standard. That's what guidelines tell us. So you can follow that so to get the most improvement in survival. Okay, now the other interventions that we can try are those which I mentioned a while ago. Okay, the entire thing. So repurposed drugs, intravenous vitamin C infusion, liquid biopsy, these things. Okay. Yeah.
Thank you, Doc. Sir Sean, would you like to add anything?
no.
I just want to say, because Doc was mentioning many times that you can, he said it already. That's because our webinars are actually replayable. So yes, you can even share this to your friends and loved ones whom we could help. All right. Okay, now at this point, we're almost at the end of the webinar. As we wrap up this evening, we would love to hear your final thoughts for our viewers. Dr. Jansen, would you like to start?
Yeah, okay, I'll go first. No, so I've talked about my approach on how I deal cancer right now. My approach, no, and in the next few months, hopefully, no, I'm adding another arsenal to my tool, which is
Wow.
supportive oligonucleotide therapy. So supportive oligonucleotide therapy is something new.
Wow.
This treatment works very similar to chemotherapy in that the goal with so they have the same goal. Okay, so the goal of chemotherapy is to reduce tumor burden.
Mm.
Supportive oligonucleotide therapy also reduces tumor burden. In other words, in simpler terms, no, it can reduce tumor size. Okay. Now, supportive oligonucleotide therapy is not standard of care, but nevertheless, this is something very quite useful for patients who are seeking other options, no, aside from the conventional one. May it be because of personal choices, or it can be because, well, chemotherapy or the conventional treatments are not applicable anymore. So this is something that we can look into. Now, I'm working together with different clinics already with this and discussing with them fees, no, clinic fees and fees in order for them to be able to carry this treatment. So this treatment, I'm quite optimistic that we would be able to do so in the next few weeks. Okay, so that's it. That's just a short glimpse on what I'm working on right now. And yeah, I'm looking forward to seeing the benefit of this treatment for to patients. No, so all right, so that would be me. I'm giving the floor to Sir Shen. Good night, everyone. Thank you. Thank you.
Thank you,
Thank you,
Doc.
Doc. You know, Doc's last sharing is just something very exciting and something to let everybody know, right? The landscape of cancer treatment is always changing and improving. So, you know, that's why we have this program. It helps us as well because it gets me to talk to Doc Jansen at least once a week to hear what he's up to. And I'm now in Singapore, so we now are in both different countries. So we get to see more, right? I get to see what things are done here in Singapore. He gets to see things there in Philippines, and we hope to bring this diversity, these different angles and updates to you. So for those of you who are tuning back to the program after some time, so we're happy to have you back, you know. But I also know that if you are back, it also could mean that someone you know, another loved one needs our help. We're always happy to help, but we also know what that means. But the good news is that you will see that the things that we share about, things might have changed from the last time you heard it. So we're always updating ourselves. So this is an ongoing process, guys. So we thank you and we hope that you'll continue to join us and support us. And also we will have if you missed the SMX on last Saturday, you really missed something because the participants, the thing that left a note left a memory on my part, impression in me was one participant actually came up to me and she said, "Your event, the forum is so different." I said to her, "Mom, what do you mean?" She said that there is kindness in the air. And I was surprised because some questions, our answers were very tough. That means we didn't just say yes, 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 can do, yes, yes, yes. We weren't just being positive. We were actually being realistic. We gave real answers. So I am so encouraged that participants said that there was kindness in the air. So I that's what we really believe in, that we want to tell the truth so that you can make the right decisions. And we hope that in our process of trying to help you, we don't just say yes to everything, that everything's okay. But we hope that our heart can still be felt by you, that you know that there is kindness in our approach. So the next XMX is going to be in November, right, Sheila?
Yes, tentatively, yes.
We fixed it in November. So I look forward to seeing more of you, and I'll hand the time back now to Sheila.
Thank you, Sir Sean. Thank you, Dr. Jansen. And of course, thank you to all of you for all your questions and for valuing our program amidst your own health battles. On behalf of every patient here and our viewers, we would like to express our gratitude to Dr. Jansen Kalalan and to Sir Shyan Lim for pouring so much effort and care into all of us tonight. As we honor Cancer Survivor Month and look forward to Father's Day this month as well, your resilience shines as a beautiful reminder of what it means to protect others, even in adversity. You're all an inspiration to us. Just a few announcements. Exclusive for websites order only. Yes, you can still buy or purchase our PPARs liquid extract or PPARs powder extract with no shipping fees. So whether you are ordering from Metro Manila or anywhere nationwide, you can avail this free shipping promos. And once again, this promo is only available via website. That's www.simplynature.ph. Also, before we say goodnight, we want to share a powerful double action deal, because if you purchase PPARs powder jar or the PPARs liquid extract via our website, you will receive free AD Pro Serum, combining internal cellular support with premium external skin nourishment. Plus, you'll enjoy free shipping if you order via website. But if you are on a tight budget, that's okay. We've got you covered, because you can get a free Renew mask included if you purchase the PPARs Soft Gel Capsule Tri-Pack. or to try blisters. Now, these exclusive promos are available via direct order here in our GC office or also in our website. So grab yours today. Another exciting promo, please stop struggling with stubborn eczema, psoriasis, and acne because we are introducing our AD Probiotic Serum. This advanced formula is specifically designed to restore your skin barriers and rebalance stressed out skin for long-term results. The best part is that you can buy this AD Pro Serum and get one extra for free. So this promo is still ongoing, so please get in touch with your assigned client service officer. All right. Great news. We're expanding our hours for a Saturday dose of wellness at BGC office. Visit us this Saturday from 10 a.m. to 4 p.m. for an exclusive advice with our resident pharmacist, Ms Jhen Get expert pharmacist choice advice on boosting immunity and cellular nutrition to elevate your health journey. Even better, because if you buy the flagship PPARs liquid vial or powder on site here in our BGC office, you can actually get a free Simply Nature umbrella. Yay! So this exclusive Saturday only deal is a perfect way to complete your regimen. So please contact your client service officers to schedule your visit here. Okay, so we hope to see you next week for another episode of Simply Healed webinar that's happening on June 11, another Thursday at 7:30 p.m. as well. Once again, thank you for spending your time with us. This is Simply Healed webinar powered by Simply Nature International and Simply Healed Medical Group. And remember, your curiosity about your health conditions and victories over cancer and metabolic diseases are what keeps us going. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night, and God bless you all.